Welcome to St Andrew's House. Now this is the headquarters of the Scottish Government's Health and Social Care Directorate. My name is Penny Taylor and I've been asked to come and put Alliance members' questions to the Cabinet Secretary Jean Freeman on your behalf. We've had to take some key themes because there were so many great questions, but I hope you enjoy our conversation. We're meeting in the same room used for the daily COVID briefings, safely socially distanced, of course. Cabinet Secretary, as you know, we are here with a selection of questions that have been submitted by Alliance members. And thank you so much for giving us the time to answer them in a very busy schedule. But our first one relates to human rights. And the question is, how can we ensure that everyone receives care that upholds their human rights? For instance, we hear that people with profound learning difficulties, profound learning disabilities, aren't receiving the support of paid carers if they are admitted to hospital, despite equalities and human rights legislation saying that they should. Surely that's something that needs fixing.
So yes, it does. And before I answer the question, Penny, can I just also say I'm really pleased to be here and very happy to answer the questions, because I think not only is the Alliance a very worthwhile and excellent organisation, but being able to answer questions directly from its members really matters, and matters to me. So this is an important question, and I think it goes to the heart of the importance of not only having policy, and I think we have good policies on human rights and a good record as a government in trying to embed a human rights approach into what we do, but we then have to make sure in practice it is implemented. So there is a policy that says that when someone with profound learning disabilities or someone with dementia, for example, even in the midst of a pandemic, is in hospital for care, that their carer or their nominated loved one, whoever it might be, should be an exemption to the other prohibition and who's in hospital with them. Because we recognise the importance of that, and the absence of that personal support or familiar face can be profoundly distressing for someone in those circumstances. But it is the case that whilst the bulk of our health service is very good at recognising this, there are times when it's forgotten about, when people are not with malicious intent, but busy, focused on other things, and don't remember that that's an important part of the work and actually a real aid to their work. So we need to do more in terms of helping our dedicated NHS staff, our social care staff, actually the population in general in Scotland, understand what human rights means in practice. It's not just two words, it means something, and we need to do a lot more on that.
Our second question relates to physical activity. There's no doubt that physical activity is good for our health and our well-being. We've known that for a really long time, yeah? But the pandemic has shown a direct link, for instance, between being overweight and increased risk of complications and even death. Are there new plans to promote and support activity, particularly among people with long-term conditions?
Again, another very good question, and it goes to the heart of something we're grappling with, and I hope the Alliance actually can help us with, and that is, for a long time, in fact, throughout devolution, 20 years, governments in Scotland have had the right ambition, which is to tackle health inequalities. Now, that doesn't all sit at the hands of health. Of course, it links to income and jobs and other issues, but health inequalities are a product of that. And we've seen in the pandemic, quite rightly, as you say, that people who suffer from long-term conditions, diabetes, heart conditions, being overweight, are particularly vulnerable, regardless of their age, to serious impact of this virus. And all the measures that we have tried over 20 years have been successful up to a point, but we're not reaching all the people we really need to reach. And I don't think that I can work that out by myself. Good as he is, I don't think Joe Fitzpatrick can work it out by himself. So that's where we need the alliance and people to tell us, what is it about what we are not doing or we are doing that just isn't working for you? Is it that it sounds too difficult? Is it that we're not really understanding what daily life is like for you and how exercise might be fitted into that? Is it that there's just nothing available locally that we can help with? And what we've seen in some areas, for example, deep end practices where we have community link workers working so well, is that they have a real success in that. And another example, which I'd like to see much more of, is in East Kilbride, where for high blood pressure, people can monitor that at home without going into the surgery. Part of what they are asked to do to bring their blood pressure down is linked to the local authorities' leisure complex, very bespoke programmes. And what we found is that when the person's blood pressure comes down and matters are now resolved in health terms, they keep up with the exercise because they can see the point. Very direct connection. We need a lot more of that, where we link leisure facilities, social prescribing, and what's happening in primary care.
And thank you for mentioning social prescribing and link workers, because we have another question on that. This question says, social prescribing and in particular community link workers have been praised for playing an invaluable role in helping to meet people's needs and make community connections during the pandemic. Now, GPs working in the most deprived areas, you referenced the deep end GP practices, have called for extra investment in links workers and further rollout. Is that likely to happen?
Well, it's certainly something we're looking at really seriously. I need to be straight with people, though, and that is to say that the resource question is really hard-pressed, and responding to the pandemic and continuing to respond to it is taking up a lot of resource. Rightly so. I mean, the social fund for care home workers, so that they are not forced to live only on statutory sick pay if they have to stay off work because they're positive for COVID. That kind of spend, I think, is the right spend. But I absolutely recognise the importance of community link workers. I think the rollout of that and the support for primary care is really important. So we're giving active consideration to it. I can't promise that we'll be able to do everything I want to do or your questioner might want me to do, but we are taking it really seriously.
Thank you. Now, another notoriously difficult area of our health and care system is mental health. And here's a question. This person says, there's no doubt that lockdown has impacted negatively on many people's mental health, particularly if they've had to shield and isolate for long periods of time. Will there be dedicated mental health support available for anyone who's been affected by the pandemic?
So this is absolutely the case. I don't think there is a single person whose mental health is as good today as it was in December last year. And for those who were already experiencing difficulties, it has been compounded. One of the, I was going to use the word success, I do think that's fair, of the response to the pandemic has been the way in which mental health services have repositioned themselves to make much better use, for example, of the digital space. And the Clear Your Head campaign and the breathing space and so on have really been effective, and people have made use of that. But that in itself doesn't remove the need for face-to-face. And again, they've used the Near Me digital consultation, so there's a screen in between you, but it is still face-to-face. My colleague Claire Hockey, who's our Minister for Mental Health, is working on and has almost finalised a transition plan to take our mental health services from where they are now into the remobilisation of the health service. looking at very practical things that can be done to widen access, whilst at the same time we are delivering for those in the most acute distress. And part of that looks at how we can give an alternative destination to accident and emergency for people who are in acute mental health distress. ED is the wrong place for them, but at the minute, it's the only place they know to go to. So we need to have, for example, in Glasgow, they had emergency crisis centres during the early days of the pandemic. That made a big difference. So she's busy looking at whether we can do more of that, as well as making it wider access possible for others.
And of course, tragically, COVID has brought end-of-life care into stark focus for us in Scotland. More people than ever are dying at home or close to home in their own community, which is often what people say they want, say they would prefer. What has COVID taught us about the support people need if they're receiving end-of-life care outside hospitals? And what help do their families require?
Yeah, it's a really good point, and I think COVID has taught us quite a lot about this if we just pause and reflect on it. And what it has taught us is what it has taught us more widely, actually, and that is the importance of services in the community. I have said since I became the Cabinet Secretary that for me, the foundation of our health service is our primary and community care. That's where most of us will have the most contact. Many of us, that will be our only contact throughout our life. So we need to balance our focus on what happens in acute and hospital care with what actually happens in social care, community and primary. And in the board work that we've commissioned to restart NHS services, we've said you have to plan this with the health and social care partnerships and the local authorities, looking at what support people need to live independently at home and to die at home if that is what they wish to do. And that support's not just for them, it's for their families. Because for that individual, one of the pressing worries they might have, knowing they're at the end of life, is support for their loved ones and how they are. And we need to give them the comfort of knowing that we're paying attention to those people too. So we need to have a good hard look at this. Our palliative care network and services in Scotland are really quite excellent, but I need to know from them what more can we do that is beyond the palliative health aspect into the other parts, because it really does matter.
Thank you. Now we're going to move on to specific issues affecting carers. Many people have said that they found that their care packages that existed prior to COVID may have been suspended, perhaps to restrict the number of people coming into a home. You know, families have picked up a lot of that slack and are delivering services that may have been delivered by professionals before. Will those care packages be reinstated at any point, do you think?
Well, I'm absolutely determined that they should be. We deliberately, very deliberately, reached an agreement with the Convention of Scottish Local Authorities for additional funding over and above what was there already, in order to try and ensure that care packages were not reduced, except in circumstances, and there were some circumstances where families said, no, we'll do that, and that was precautionary on their part in terms of protecting their loved one from the virus as they saw it. But others, that was not the case. And we put in additional money precisely to prevent that happening. By and large, in many places, that did not happen, but in some it did. And I still need to understand clearly exactly why, because the other side of provision that we put was the social care portal. You might recall it, where we asked retired or other social care professionals to volunteer to come back, be paid, but volunteer to come back. precisely to make sure that we had sufficient staffing and that local authorities and partnerships could draw down from that. That didn't work everywhere because geographically there wasn't necessarily the right spread. So there were some difficulties, but I am absolutely determined that those packages are reinstated where they've been stopped, because they are critical to people being able to live as independently as they want to. And they have as much right to do that as I do or you do. So it really does matter that we get this right.
Now, a huge contribution is also made by unpaid carers, families or friends of people that need help, yeah? Unpaid carers have told us that they may need state help to enable them to continue, and an example is given. For instance, full-time students who care for a parent, for instance, cannot also claim carers allowance even if they become, for instance, a full-time student, even if they continue to provide that care on top of their studies. Is that fair?
So I understand this, and of course from my previous role as the Minister for Social Security, I understand it very well. And I know that Shirley-Anne Somerville, who took over that work and is doing excellently in that role and making that happen, is looking very closely at what we can do to make the eligibility for carer support fairer than it currently is, as we incrementally take over those additional powers. So I'd hope, I know that she's keen on that. She's also very conscious of the cliff edge that carers face when the person that they are caring for dies and all the support that they have received suddenly comes to an end. That's deeply unfair, and at a time when people are also bereaved. So all of that is being looked at with Shirley-Anne, and I'm certain that she'd be happy to directly respond to people on the work that she's got underway.
The media generally has focused very heavily on the experience of older people and people living in care homes in terms of the effects of the pandemic. But we're going to have a post-COVID review of adult social care, I think. Will that include people who live in the community, for instance, in supported living, as well as those receiving care at home?
Yes, it will. So I had said before that I thought that we needed a fundamental review of adult social care, what its purpose is, what the people who receive it want from it, very important that it's person-centred, how it's delivered, by whom, how it's funded, how it's regulated. And in the coming days, the detail of that will become clearer for people. And the intention is that this is not a long-term exercise. This is a relatively quick exercise, important to hear from the receivers of adult social care, regardless of the location of where they receive that. And it will build on work that had begun, particularly using the receivers of adult social care, the users panel, the work that was well underway before the virus appeared. So a lot was done there that any review can build on and draw from some of the conclusions of that early work that we undertook. So this will happen. People will then need to, the review will reach the conclusions it reaches and the recommendations it reaches, and there'll be some important choices for the public in Scotland to make and for politicians of all parties to determine what they think should happen, and that includes this government. So we'll get there, and we'll get there in relatively short order.
And if there are issues about how to pay for that, what will we do in Scotland?
Exactly so. It's not the fundamental issue in all of this. The fundamental issue in all of this is how can we design and deliver adult social care that meets the needs of those who receive it, regardless of where they live. That's not just geographically, it's if they live in a care home, if they live in sheltered accommodation, if they live in other kinds of residential, or they live at home. It shouldn't matter. Having worked that out, you then need to work out how do you deliver that, and very importantly, how do you pay for it? And what are the choices for all of us to make about what we're prepared to pay for? And then how do you regulate that to make sure that it is safe and that the quality standards that you need and should expect are consistently being delivered?
Now, earlier in our conversation, you mentioned the digital space, and the next question relates to that. According to Matt Hancock, your counterpart south of the border, from now on, all GP consultation should be digital unless there are good reasons not to. Are we going to take the same tack in Scotland? Will general practice go online, do you think, here?
Not entirely, no. And I don't think it should. I think that, so what we have seen at the outset of responding to the pandemic, we made sure that GP practices, primary care services had access to the kit, if you like, that would allow the scale up of Near Me, which is a digital consultation, a video consultation that had proven successful in the Highlands in particular. That scaled up hugely during the early days of the pandemic, and the response from patients using it and from GP and other practitioners, family nurse practitioners were using it, for example, was hugely positive. So we want that to stay because it works. But that does not take away the need for the GP in particular to actually sit, as you and I are doing, relatively properly distanced, but able to appreciate the nuances of facial expression, of body language, that it really is important to sometimes get to the questions that the patient isn't quite telling you, so that you can you understand the situation a bit better than you might otherwise do. So the BMA are very clear on this, the Royal College of General Practitioners is very clear on it, and I think they're right. There is a big space for digital that works for very, very many patients and GPs, but that shouldn't knock out face-to-face.
How can we ensure that people with limited resources, maybe can't afford a computer, for instance, or who don't understand how to use the technology, or who don't have, for instance, good digital access, they don't have the wiring, how do we ensure they're not excluded from the digital space if it's going to be so important into the future?
Well, in part, I think, by what I've just said, and that it is not the only way that you will ever be able to access primary care services. So there has to be the opportunity for the patient to say, I don't want a digital consultation, I want to come and see you. And also for the GP or the practice nurse or whoever it might be to say, no, I actually need to see you for this. I need you to come and organise it and all the rest of it. And in part that takes account of those for whom using technology is not as easy and doesn't come as automatically as it does for others. Should also take account of some situations where the broadband signal or whatever is not as good as we want it to be. But in addition, elsewhere in government, there is a lot of work going on, again, that will become clearer over the coming weeks about increasing people's access to the kit so that they might want to, but they don't have the resources to actually have either the phone that they can use or the laptop that they can use. So we need to make sure that as we move into more and more the digital age, and Scotland has so much to offer in terms of the economy in that regard, that we're not leaving people behind here. That is utterly unacceptable. So the work is underway on that.
There's a lot we're learning about COVID-19. And one aspect of that is the potential for a small number of people, but a significant number of people to suffer what they call long COVID, which is having after effects of infection, maybe in the lung or in various other ways. And they're expected to suffer that for some time to come. We don't yet know how long. Are there plans for upscaling specialist rehabilitation services in Scotland? Because rehab is going to be incredibly important to those people to get them back up to full fitness. You know, we know it helps people maintain independence, it cuts hospital admissions, it's cost effective, it enhances quality of life. Does everyone have a right to rehab? And if so, is it being met?
So we just published, I think, from memory last week, a framework which has the title Recovery Through Rehabilitation, particularly focused on exactly that issue. What we're finding out, as you say, is that people who've been made ill by the virus some have long-term health effects. Some have medium-term health effects. Almost everyone who has been hospitalised, particularly if they've been in intensive care, has a significant rehab need in terms of learning to swallow again, learning to walk again, overcoming fatigue. And it's not just the lungs and the respiratory impacts, we're also seeing cardiovascular impacts, and we're seeing that both of those in younger people. So the framework that I published is very much allied health professional led. It's led by my chief advisor here in Scottish Government, allied health professional, because that will be the primary workforce for this. And it is looking at existing rehab facilities and how we need to expand and extend them, how we can use digital to assist with some of that, and then how we can make sure that is equitably available throughout the country. For some people, it will be a relatively short time that they need that. For others, it may be much longer. And we're also looking at the whole respiratory pathway because we anticipate more people needing that long-term respiratory care than we have seen up until now. We don't yet know what the numbers might be, but we do expect an increase in that demand.
Thank you. Now, 6 months into COVID in Scotland, we're talking about remobilising the health service, so stuff that was put on hold because of the heat of the pandemic, bringing that back in. How can we encourage people to make use of things like eye checks, dental checks, you know, the other routine health maintenance things that we do? And how can we ensure that remobilisation is fair for everyone? And that includes people living with long-term conditions, disabled people, and their unpaid carers.
So that's a huge question. And the first important thing I have to say is, yes, we are remobilising our health services. Those services that were paused all through the pandemic, we still did emergency life-saving care and urgent care, including urgent cancer care. But other services were paused, not least cancer screening programmes. There's a balance to be struck here because although we are not seeing the numbers of people with COVID who require hospitalisation or intensive care at this point, our health service is still battling the virus, and they're doing it through Test and Protect, all those health protection teams responding to clusters and outbreaks, hugely intensive. I need them actively engaged in a system-wide delivery of the increased flu programme, vaccination programme. 2.25 million people need to be vaccinated by Christmas. That's a huge exercise. And at the same time, in fairness, we have a workforce that is both physically and mentally exhausted because of what they did in those 3, 4, 5 months. So those are the, if you like, the rate limiters to how we can remobilise. Recognising that, and your point about how can we make sure it's equitable then? Because not every part of the country at every point in those 4 or 5 months had the same pressure level on them. So arguably some parts could start a bit quicker than others. That's not particularly equitable though. So if you take the framework for cancer surgery, which again it was published, but it's also being practiced now. That is an agreement that there is a clinical prioritisation that applies to every part of the NHS on prioritising patients based on clinical need for cancer surgery, and that boards have to cooperate with each other to make sure that patients will be seen according to that priority, that clinically led priority. And patients need to know that that might mean you have to travel outside your board area to get the operation you need. And we'll apply that to all the other restarting procedures, including elective work. But it's really important that I am completely honest with people, and that is that we will not see, for all the reasons I've given, the NHS start in October the way we left it last December. That is not possible because we're still fighting this virus, and the restart will be phased in that way and prioritised in on that clinical basis.
That's really interesting because, you know, given that health and care in Scotland will need to be transformed once COVID is in history, let's put it that way, how can people who use services and their carers help to shape this? You know, how can they have their voices heard? And will there be room for local autonomy in shaping services? So
I guess there's two parts to the answer to that. I have what I call the Mobilisation Recovery Group, which has some key stakeholders in that, the Royal Colleges, the BMA or RCN, the trade unions, but it also has Ian Welsh from the Alliance on it. And that is precisely to ensure, as long with the work that the Alliance has been commissioned to do, that we hear the patient's voice in this. So we have that perspective. It's not just about either the managers or the deliverers of care or the politicians who make the decisions. It's also what are patients telling us. And the other point I want to make is that the reshaping of the health service is integral to remobilising. There were some really innovative practices. I've mentioned the mental health crisis centres, the use of digital, the use of much more community services, pharmacy first, for example, as well as the use of optometry and dentistry as part of the whole primary and community area. All of that is being fed into, well, how do we restart these services where we don't lose the good practice that the pandemic produced that still makes sense in this phase of responding to the pandemic.
Is it possible, do you think, to achieve better parity of esteem between the NHS and social care? I mean, for instance, at the peak of the COVID outbreak, we had people clapping for the NHS and, you know, perhaps less engaged with supporting all those people that keep people well living in the community. Now, the NHS is utterly dependent on good social care to keep people well and keep them out of hospital, yet social care operates on just 1/5 of the NHS budget. Does the balance of spending have to improve if esteem is to rise?
So I think you have to do two things. It's not just about money, but that is important. And that money question, if you like, goes back to our earlier discussion around the review of adult social care, because there are some important decisions for all of us as citizens in Scotland to make about what are we prepared to pay for. And that absolutely goes to the heart of reforming adult social care. But it isn't just about money, important though that is. It's also about recognising what I said earlier about primary and community and social care are the bedrock of what we do. And we have allowed, I think, a perception that the NHS is about hospital care. It is about hospital care, and our acute services are quite literally life-saving and fantastic in what they do. But none of us want to be entirely dependent on acute services. Personally, it is my fervent wish that I never need them. to help me never need them, barring accident and factors I can't control, it will be primary community and social care that will help me be healthy, help me be independent, help me live well as I can. And we need to find ways of articulating that better without diminishing the importance and the proper recognition of the levels of skill and professionalism that exists in our acute care.
Thank you. Now, previous health secretaries have set visions for the future. We famously had a 2020 vision, which sounded like it was a long way away when it was conceived. However, we are in 2020, and do we need to refresh a vision? A, have we achieved it, our 2020 vision? And B, do we need another vision looking perhaps 20, 30 years into the future?
So I think we were pretty well on track on the 2021, and then, of course, other things came along, not least a pandemic. That has offered us quite a lot of opportunities, in fact, and I don't want to be unhelpfully optimistic, but I do think how you respond to those situations offers you opportunities, and we've touched on some of them before. My own feeling is that the two major things that we need to be doing is making sure that we continue to build an exemplar public health service in the widest sense of that, and have a forensic focus on population health. I think that then takes us into all those other strands around community, primary and social care, around understanding what we do to respond to viruses or flu pandemics, should we ever see one of those. I guess if I'm completely frank, I'm a bit less keen on visions, because I'm not convinced that for the normal person standing at a bus stop right now, that makes, if I was to stand up to them and say, go up to them and say, so my 2030 vision for health is, yeah, thanks very much, but when can I see my GP? And is the pharmacy open? And what do I do if I break my ankle? That's what matters. So it is the detail and the delivery and the understanding of what matters to people that is really important. And I think you can encapsulate that by talking about an exemplar public health service and a real focus on population health. That's more than about, important though it is, no smoking campaigns or eating healthily and exercise. That's about what do we do about diabetes and respiratory conditions and all those other things that people are struggling to live with and need help and support to be able to do that.
Thank you so much. Now, you've answered all the Alliance members' questions. Thank you. I wonder whether I could move us on to a little bit about yourself. Let's bring the focus back to you. You've announced your intention to stand down from government before the next election, the next Holyrood election in May. What would be your advice to the next Cabinet Secretary?
Well, that would be a bit presumptuous of me, but I've never been slow at giving my opinion. So my advice would be, in everything you do, make it as person-centred as you can and take people with you. You have to listen to as many voices as you can. That absolutely is our Royal Colleges and our trade unions and our RCN, BMA, all of those, but it also has to be the patient's voice.
Thank you. Do you think that the next Cabinet Secretary should have social care, the word social care in their job title? Yours is your Cabinet Secretary for Health and Sport. Do you think it's a miss not to have social care in there too?
I can see a strong argument for that, because I think that helps to, again, in answer to one of your previous questions, it helps to raise the profile and consequently the perception of importance. I think social care is very important, but I think if you have it in your title, then people almost subliminally recognise that it is there is an equity there between health and social care.
And then finally, on this section, 2 other questions to ask you, but finally, what's been your most important piece of learning in your job as Cabinet Secretary?
I think the most important piece of learning, 2, I think. One is to maintain an absolute focus on delivery and making sure that my view is that we have, through our health boards, a significant delivery arm for health. That's not to say that they are without knowledge and experience, and particularly of their local area, but I think we need an absolute focus on the delivery of policy and seeing it through and being sufficiently fleet of foot to alter it if it is not working exactly as we would want it to. And I think the other learning for me is the importance of, delegation, in that it is not possible as the Cabinet Secretary for Health and Sport to cover absolutely everything. I am accountable for everything, though, and that's important to remember. But delegating and giving people the opportunity to see through in different areas really does make a difference.
And then looking to the future, how important do you think the work of the Alliance is in delivering the objectives of the country, really, around health and social care?
So I think the work of the Alliance is absolutely critical, and I'm not just saying that because that's what the interview is being promoted by. I have seen firsthand in the Tayside mental health work, for example, the capacity of the Alliance to be trusted by individuals who, in truth, had lost trust in institutions. The Alliance could get through that, and that really matters. If we're serious about what I'm saying about you need to listen to the patient's experience and their view and the view of their family, you need to have a route to that. With the best will in the world, people often will not tell me as a Cabinet Secretary exactly what they think and feel about something. So I need another way to get to that. And the Alliance is excellent at that work, but it also then draws on what it learns and understands to form views of its own that it wants to then put to government. And I think that is really critical.
And this year's Alliance conference is very different. For the first time, it's digital for a start. What's your key message to this year's conference delegates?
Oh, that's quite difficult. I would say 2 things, I think. I think that what we saw in the early phase of the pandemic, and we still see, was across the country, if you like, a common purpose. And that was, what is it that we all need to do in order to minimise the damage this virus can do, not just to me, but to the person I don't know. I want us to try and hold on to that in some way. It's harder when we're not in the crisis period, but that sense of common purpose, whilst we may disagree in parts about particular actions or decisions, really made a huge difference. So my message is, I need you to tell me, how do we retain a sense of common purpose on health and social care? And I guess my second message to everybody is, please stay well. Please look after yourselves because you matter.
Thank you very much, Jean Freeman,
Not at all,
Cabinet Secretary for Health and Sport. Thank you.
Thank you.